Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. As a reminder, first reminder, please mute yourself, but always show your video picture. Please sign in your name, your Facebook account, or email address in the chat box. Please include the names of your companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video. Another reminder, please take the online learning com evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. The link, I have placed the link in the chat box. Another reminder, obtaining 50 or latest certificates will entitle a participant to a voucher for a ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper. Can you show your faces for memorabilia purposes? Show your face. Okay, last call. 1, 2, 3. 1, 2. Meron pa? May pahabol? Mel, Ralina. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. If I'm not mistaken, this is our 108 ROJoson pep talk for today. So my pep talk today is entitled Leptospirosis and Flood. The empowerment objective is for the lay people to have an essential understanding of leptospirosis and flood in their health management. I suppose all of you are familiar what is known as leptospirosis, and it's usually associated with the flood, okay, with the floods in the street. Okay. The contents of this particular pep talk will be the following: what is leptospirosis? How does one get leptospirosis? What is the connection between leptospirosis and floods? And when to suspect leptospirosis? What are the diagnostic tests? How does one avoid leptospirosis in general, and in particular during floods? And when to consider prophylaxis against leptospirosis? And lastly, what is the usual treatment for leptospirosis? I'd like to make a disclaimer that this talk will contain my thoughts, perceptions, opinions, and recommendations culled from my personal experiences as well as from the experience of other experts. Let's start with the first topic. What is leptospirosis? So an overview of the disease called leptospirosis. It's a bacterial disease that affects humans and animals. So both humans and animals, not only humans, not only animals. It is caused by a bacteria, not a virus. By a bacteria, not a virus, belonging to the so-called genus Leptospira. That's why the name is leptospirosis, the name of the disease. In humans, it can cause a wide range of symptoms, some of which may be mistaken for other diseases, especially those with flu-like symptoms. Some infected persons, however, may have no symptoms at all, just like in any other diseases, in any other infection. Okay, some would be asymptomatic, some would be symptomatic, just like when we have COVID, some are symptomatic COVID, some are symptomatic COVID. And without treatment, leptospirosis can lead to, this is the most dangerous part, kidney damage, meningitis, meaning inflammation of the membrane around the brain and spinal cord, liver failure, respiratory distress, and eventually or even death. Leptospirosis is an infectious disease caused by bacteria, not virus, belonging to the genus Leptospira, and is transmitted directly or indirectly from animals to human. So it starts from the animals going to human. So yung human to human transmission occurs only very rarely, not very common. Okay? It's called a zoonosis. Zoonosis means an infectious disease that can be transmitted from non-human or animals. So from animals to human being, just like rabies is also from the rabid animals, from the animals to human. So it's another type of zoonosis disease, rabies. What animals are usually infected with Leptospira, with the bacteria called Leptospira? The reported animals are usually the rodents, cattle, pigs, horses, even dogs can be infected with Leptospira, and wild animals. So among those animals that have been known to be infected by Leptospira or commonly infected by Leptospira, the rats and other rodents are main carriers of bacteria, especially in the city. Okay. The rats usually comes from the sewage system, okay, and then getting infected with Leptospira. Okay. How does one get leptospirosis? Basically, it's contact with an infected animal urine. Pag yung katawan natin ay come into contact with infected animal urine, okay, so pwede tayong tamaan ng leptospirosis, or kumain tayo o uminom tayo ng contaminated water and food, or coming into contact with soil contaminated by infected animal urine, may leptospira, okay, which are usually seen in floods. Okay, so the most common way to get infected is through the urine of infected animal. That's the most common. Okay, or contaminated water getting into the eyes, nose, mouth, and broken skin, such as a cut or a scratch. Okay. One can also get infected by eating contaminated food or drinking contaminated water. So not only by contact to the skin, to the eyes, to the nose, to the mucous membrane, but also by eating or drinking contaminated food or water. What is the connection between leptospirosis and floods? So we know that flood water may be contaminated with the urine of infected animals, especially rats in the city, either from the contaminated soil, from the sewage, from other surfaces, and from the infected living animals peeing into the water. like dogs, pwede pa rin infected with leptospira, they can pee into the water, okay, to the floods. Person wading should be wading through the flood that is potentially contaminated with leptospira are at risk of getting spirosis. So kung nakababad tayo sa baha, no, which we know is palaging potentially contaminated with leptospira, there's no such thing as sterile na baha, no, or clean na baha, okay, especially in the city. Okay. So we are at risk of getting leptospirosis. When to suspect leptospirosis? So leptospirosis should be suspected in any patient with a history of risk exposure, meaning naka-expose tayo sa contaminated water or floods na may possible leptospira, okay? And then that patient is manifesting flu-like symptoms. So yung mga flu-like symptoms will be mga headache, fever, myalgia, no? Abdominal pain, chills, rashes, etc. Okay. So there may be other symptoms on top of the flu-like symptoms, like symptoms of organ dysfunction on the brain, kaya yung sinabi ko kanina, meningitis, may dysfunction on the heart, the kidney, and the liver. Okay. So the presence of symptoms of organ dysfunctions connotes severe leptospirosis. Kung wala pang organ dysfunction, usually we consider them as mild to moderate. No? Pero pag meron ng mga liver failure, kidney failure, may konting may headache na may manifest suggesting meningitis, then we now start thinking of a severe leptospirosis. So yung exposure, usually, kasi minsan tinatanong natin kung gaano katagal yung history niya of exposure, just take note, it has a range of 2 to 30 days. Okay, so let's say 2 days after being exposed to the floods that can be contaminated with leptospira, you start thinking of leptospirosis if you have these flu-like symptoms. So kung 30 days after, baka wala na. Okay, but 28 days with 25 days if you have this history of exposures, flood, and then you have symptoms on the 25th day, pwede pa rin. No? Pero usually, mas madalang na. Usually, the most common onset of the symptoms of flu or disease, usually mga 1 to 2 weeks. So ito yung mga non-specific flu-like symptoms, high fever, red eye, abdominal pain, headache, muscle ache, chills, rashes, nausea, vomiting, yellowing of the skin. Kung may jaundice na ito, most likely tinamaan na yung liver. Kung yung ihi, kumakonti, most likely yung kidney tinamaan na. Okay. As I said, symptoms are non-specific. Okay, flu-like symptoms will include fever, headache, myalgia, cough, and rashes. Kaya minsan, mahirap i-differentiate now from COVID-19. As we know, meron pang COVID-19 going on in the country. And then flu, pwede rin. Then dengue, pwede rin. Leptospirosis, pwede rin. Okay. So, pero kung merong exposure to the flood, wading through the floods within 2 to 30 days, you suspect first leptospirosis, no? Although the other diseases are possible. Okay. COVID, flu, dengue. What are the diagnostic tests for leptospirosis? Usually, ang diagnostic test would be the molecular test, just like for the COVID, with molecular tests like the PCR. Okay. And then, so these are quite expensive. And then the serologic test, meaning using the blood, no, and then testing for antibodies. So the most commonly used test will be the microscopic agglutination test. Okay. So it tests your blood serum for leptospirosis antibodies. There are other specific, non-specific tests like CBC, now, just to check whether your blood count is low, and then there's a problem in your clotting mechanism. And then you can check also your urine. Okay, kung may mga abnormality na baka affected by the leptospira into your kidney system. Okay. How does one avoid leptospirosis in general? So to reduce the risk of leptospirosis, avoid animal urine. As I said, that's the most common cause. And contact with water, especially flood, which are potentially contaminated with leptospira. As I said, there's no such thing as clean flood, no such thing as sterile flood. Avoid water and foods potentially contaminated with leptospira. So pag lumusod kayo sa baha at nabasa yung kamay ninyo at meron kayong kinakain, note that you might be contaminated, you might get leptospirosis by doing that. Now, the other way of avoiding leptospirosis, of course, always wear protective equipment if working with animals. There are people, yung mga vet med, now working with animals, they should wear protective equipment so that they don't get leptospirosis. Now, for those with pets, we know that a lot of people has pets. So check for leptospira as much as possible. And if kung positive sila, so they should be treated by a veterinarian. Other preventive measures on the pet, avoid touching your pet's urine. Kung umihi sila, avoid touching it. Then if the pet pees in the house, clean it immediately. Have your pet pee away from a body of water. Kung saan umiihi yung mga aso, okay, or places that people will touch like benches, then mahahawa rin tayo. So wash your hands after touching your pet. That's the best protective prophylaxis against leptospirosis. Now, during floods, how do we avoid leptospirosis specifically? So avoid wading through flood waters if one can avoid it. So as much as possible, avoid it. No? Pero alam natin kung minsan na hindi natin ma-avoid because bigla na lang umulan, biglang bumaha, wala tayong dalang mga payong, ay wala tayong dalang mga boots or clean sapat, yung mga waterproof sapatos or chinelas, no? Okay. So if you cannot avoid wading through flood waters, then wear waterproof protective clothing, shoes, and boots. Okay. Clothing kasama na rin yun, baka mag-splash yung mga contaminated water into your dress, into your clothes. Okay. If coming into contact with flood water, so anong first aid nito? Wash the area with soap and water, clean water as soon as possible. If the soap and clean water are not available, then you might have to use alcohol-based wipes or sanitizers, which is the most readily available nowadays. So if wounds coming into contact with the flood water, kung may wounds kayo, may sugat sa katawan, wash with soap and water also, but very thoroughly, okay, mga 10-20 minutes kung pwede. Consider consulting a physician without an S for prophylaxis against leptospirosis. Kasi mas risky kung meron kayong sugat sa katawan that are contaminated with the flood water. So want to consider prophylaxis against leptospirosis. When you say prophylaxis, it means that you are trying to decrease the likelihood of leptospirosis infection. So dinidecrease lang ninyo ang chances of leptospirosis infection. There's no such thing as zero risk, but dinidecrease lang ninyo as low as possible zero. Okay. Consider prophylaxis when there is significant risk of leptospirosis infection. Kung meron lang what are the significant risk? Kung hindi naman kayo in contact with flood water that are contaminated with leptospira, then you don't need your prophylaxis. So automatically there is a risk for leptospirosis when a body or a body wound, a body here, walang sugat, pero ito, may isang sugat sa katawan, exposed unavoidably to flood water that is potentially contaminated with leptospira and other germs. Okay. So yung guidelines dito, how to protect yourself against leptospira is also applicable to other types of diseases, mga other germs. So factors to consider when we give prophylaxis would be the duration of exposure, kung mahaba let's say nakababad ka ng mga 1 oras, mas mataas ang risk mo compared to 1 second na nakababad ka lang o 2 minutes, no? Mas mababa ang risk mo. And then, of course, the presence of body wounds, kung may sugat, mas mataas ang risk for leptospirosis compared to walang sugat. And then we classify the risk into the low, moderate, and high risk. So this is a classification given by the WHO. So it classifies the risk as follows. No? So they call it low risk exposure when the individuals has a single history of wading in flood or contaminated water but without wounds. Walang sugat, walang cuts, walang open lesions on the skin. So it becomes, it goes into the category of moderate risk exposure kung yung tao ay merong history of going into the flood or contaminated water and there is a wound, okay, or wound, okay, pwedeng several, or there is accidental ingestion, baka nainom niya yung contaminated water or even food. No? Okay. So, high-risk exposure, another category defined to us by WHO or by DOH, okay, is defined as those individuals with continuous exposure, tuloy-tuloy, those having more than a single exposure for several days because they are residing in flooded area. This is the mga, kasi we know that in Dagupan, at least I know, for the past 5 days, 10 days, yung flood hindi nagsasubside. So they're constantly flooded. So kung nakababad ka for those 5 days, you are at high risk for exposure. So yung mga rescuers also and mga relief workers who are constantly nakababad sa flood waters are at high risk exposure. Kahit na walang sugat, na basta matagal ang exposure, it's automatically considered as high risk. Another situation is that swimming in flooded waters, especially in urban areas, mga bata, di ba? Naglalangoy sa mga swimming pool sa flood water, okay, can also be considered as high risk for leptospirosis. So this classification is actually 2009 pa ito, walang bago, mukhang applicable pa ito. So this was formulated by San Lazaro Hospitals in 2009. When I look at the literature, ganun pa rin ang ina-advise nila. So for low risk, you can take doxycycline 200 milligrams single dose within 24 to 72 hours from exposure. So the timing is also very important. Now for moderate risk, you can take 200 milligrams once daily, but this time for 3 to 5 days. Kasi may sabihin natin, may sugat ka. So you take it for 3 to 5 days. But this has to be started immediately after being exposed to the flood waters. So within 24 to 72 hours, 1 to 3 days. For high risk, the advice is to take the doxycycline 200 milligrams once weekly, every week until matanggal yung matapos na exposure to the flood water. So weekly, let's say kung 5 days ka naka-expose doon, no? So you can take it once lang, pero kung 1 month ka naka-expose sa flood water, you can take it 4 times, once every week. Now for pregnant women, we know that there are a lot of pregnant women who cannot avoid being exposed to the flood nowadays. No? The advice is do not take doxycycline. Okay, so take amoxicillin 500 milligrams, 1 tab 2 twice a day for 3 days. If allergic to amoxicillin, then they can take erythromycin, 250 milligrams BID twice a day times 3 days. Now, for children, you can give doxycycline 4 milligrams per kilogram. So you have to compute that, but the maximum dose is still 200 milligrams. So when to consider prophylaxis against leptospirosis, I mentioned about the doxycycline, and also, but take note that the most important prophylaxis is to wash your body or body wounds Expose to the flood water as soon as possible, within seconds, within minutes, kung pwede. Na? Hugasan kagad. Just like when you have a dog bite, pag nakagat kayo ng aso, hugasan nyo kagad. Yung sugat nyo, yung galing sa yung kinagat ng aso, hugasan nyo kagad. That's very important, the timing. Okay. Number 2, maintain a good body resistance always through a healthy lifestyle, because we know that there are some patients, some people who got infected with leptospirosis pero on their own, gumagaling sila naman. Na? So, minsan, because a good body resistance, hindi natutuloy yung frank infection. Kaya minsan, they are labeled as asymptomatic, no symptoms, leptospirosis. So good body resistance may prevent clinical symptomatic leptospirosis, and also it may also prevent progression to a severe leptospirosis. So importante itong body resistance also, always. No? So keep a good body resistance not only for against leptospirosis during the rainy season, but it's also good for other diseases, no? All year round. What is the usual treatment for leptospirosis? If the infection is mild, then doxycycline at the moment is still the drug of choice. This is the most popular. Okay. Alternative options include ampicillin, amoxicillin, and azithromycin. So kung walang doxycycline, kasi kumisan, the boticas run out of doxycycline kasi maraming bumibili, or baka yung mga government hospitals walang supply. So take note that you can take ampicillin and amoxicillin, which are probably as effective. Pero ito naging popular, no? Okay. If the infection is moderate and severe, now this time the patient has to be confined, and what is usually given is the intravenous penicillin G. Okay. Or kung wala niyan, third generation cephalosporin or erythromycin. So the other treatment for leptospirosis, okay, especially for the mild ones, no, that you must take a high oral fluid intake, and then rest is also very important. Healthy diet, healthy mind, walang masyadong any stress, although control lang anxiety. That's why you have to know something about leptospirosis. Kung wala kayong alam, magpapanik na kayo. Okay. Moderate exercise still there. Kahit na may sakit kayo, may konting exercise, wag totally wala. No? Kasi exercise can also increase your body resistance. And other meds as needed. Like kung mataas ang fever, you can take paracetamol. Kung masakit ang tiyan, you can take some medicine against that. Okay. So, let's end my I think that's the last slide. So take away. Okay, I have discussed all these topics. I won't read them anymore. Okay. And then take away in relation to patient empowerment. Be always in touch with reliable medical information on leptospirosis and flood. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, knowledge, kakayanan, karapatan, right, kapangyarihan. Okay. To gain greater control over decisions and make better decisions when it comes to possible leptospirosis and during floods, okay, in yourself and in your relatives, in your friends' health. Okay. So you can try to advise them. So with that, I end my pep talk today. I hope I have empowered you to have a better understanding of leptospirosis and floods in your future health management. Okay. So before we go to the QA portion, reminder, please take the online learning evaluation test exercise for mastery of learning and get a certificate like this. Then 50 OLETE certificates will entitle 1 mentee to a voucher for ROJoson telemedical consultation. Feedback, please type in your feedback on the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the question and answer and interaction. So please show your faces now. Okay. Ready? Wala nang gustong sumali sa picture taking. Habol. 1, 2, 1, 2. Oh, may pahabol. 1. Wala na, last call. Last call. 1. Steady, steady. 1, 2, 3. Okay. So the floor is now open for questions, comments, some input from you, from your experience, sharing of experiences, and even consultations if you have. How many have gotten leptospirosis before? None? Butit na lang? Okay, that's good. How many have relatives that you know that got leptospirosis? Meron? Ayan, Abet, meron? Can you share? Nabuhay, namatay? Unmute. Unmute.
Nabuhay siya, kaya lang nag-dialysis siya for 1 week.
Ayan. Buti na lang, 1 week lang. Okay.
Nag-dialysis siya sa NKI kasi nga yun ang finding sa kanya lepto.
Yeah.
So, mga i-dialysis siya for 1 week. Then after that, okay na siya. Balik na siya sa dati.
Maswerte siya. Okay. At least 1 week lang at ano. Okay.
1 week lang.
Good. Okay. From my experience, I don't know kung tama ako since I'm not really a specialist on this. From my experience, na nakikita mga pasyente is yung pinaka-severe is kidney failure. Kidney. Kaya ang dami na da-dialyze na. Okay. So, any other sharing kung meron? Walang mag-share. So how many have palaging may dalang pag umuulan, may aside from payong, may botas? Paano yung dinadala mo? Malaking botas mo?
Hindi, half lang. Nasa clinic natin yun eh. Para nga in case na bahain, meron akong bota.
Ay, paano on the way? Paano on the way ka?
Ay, yun lang. Pag on the way, wala.
Kaya nga iniisip ko kung paano idadala yung botas when yan. Pag umuulan, kasi very bulky yung botas eh, di ba?
Bulky, mabigat.
And then somebody will have to invent yung mga yung portable na malambot na. Okay. So plastic. Pwede bang plastic? Ito, no. Pasok din yun eh, no? Plastic.
Meron kasing bota na stylish eh. Ganun yung bota ko, kaya lang mabigat pa rin.
Gano'ng kahaba?
Hanggang mid ng iyong binte.
Okay. Masyadong binte.
Oh, mid ng binte.
Binte, mataas din.
Oh, mid ng binte. Hindi umabot ng lower knee. Basta mid ng binte.
When you say binte is what? Thigh, di ba? Binte is thigh?
No. Here.
Leg.
Mid ng leg mo. Sa leg.
Okay. So mid leg usually yun. Kala.
Oo.
Ano yung thigh? Anong thigh sa Tagalog? Hita?
Yeah, thigh is hita.
Okay. Binte is leg. Okay. So, usually, pwede na yun, di ba? For the moment, usually, mga floods naman, mga 1 inch, 1 foot high usually, no? Ganon. Pwede na yung, yung up to the 1/2 of the binte, no? So kung mas ewan ko kung makakahanap tayo ng mga botas na portable na madaling dalhin, no? So dapat may magke-create niyan. Malaking business 'yan kung magkakaroon ng Okay.
Dok, may nabibiling yung shoes cover, 350 yata yung plastic lang, parang inflatable siya. Sa SM nakita ko dati 350 yata yun, o 300.
Shoe cover lang.
Oo, cover lang siya.
Hindi hanggang binti yung mataas.
Hindi, Dok.
Baka pwede na rin 'yon.
Parang knee-high lang ang dating, yung knee-high na stockings, parang ganun lang.
Oo. Sige, short of anything, short of nothing, yun na lang. Kahit na Kasi minsan yung sapatos, yung tsinelas, nababasa rin, di ba? Okay, pag dumadaan tayo sa baha, di ba? Okay. So, pwede na rin yun kung pero kung mas maganda, kung merong mas mataas ng konti, no? Up to the heat binti.
Or in emergency cases, binabalot namin ng plastic. Plastic yung paa.
Paano? Sige, babalutin. Paano yung sapatos ninyo?
Tinatanggal namin, medyas lang. Kasi minsan yung pinoprotect namin din yung sapatos. Yung sapatos namin masusok.
Ano klaseng plastic ang dala ninyo?
Yung plastic, yung mga plastic sa grocery.
Nirarap na lang ninyo?
Oo, niraround lang. Para lang
di ba bandali masira din yun pag short distance lang?
Yeah, yung from halimbawa sa office natin to UN, tapos pagsakay namin ng bus, tinatanggal na namin.
Okay. So nakapaa kayo pero wrap in plastic. Okay? So baka kailangan i-doble o triple para mas makapal. Mapupunit din yun, di ba? When you walk. Okay. Okay.
Or tricycle from Manila Doctors to UN, kaya lang super mahal.
Okay, that's another yung mga ready solutions that you can think of, no? Okay, just to avoid na nakababad yung paa mo sa baha, no? Okay. So any other how much is the doxycycline? Alam niyo kung magkano? Who has an experience with doxycycline? Wala. Okay. So usually mga 100 pesos din yun isang tabletas na 100 milligrams, so 200 milligrams, micrograms, so mga 200 pesos. No? Okay. So kung wala noon, you can take amoxicillin or ampicillin, mas mura yon. No? Okay. If it's just for simple prophylaxis. Pero sana, kasi with that guidelines by DOH, by kahit na walang sugat, nire-recommend pa rin ng doxycycline. Sa akin, baka kung maganda ang resistance ng katawan mo, saka nilinis mo na kagad, you don't need to take the doxycycline anymore. No? Okay. So, but it's really up to the person, no? To make a judgment. No? Kung kukuha siya o hindi. Okay. I suppose most of the time, hindi rin kayo nagdo-doxycycline, di ba? Tama? Wala rin nangyayari, di ba? So it shows that pwede, you don't really have to go to take doxycycline every time na napasubo kayo, natapakan niyo yung baha, no? Then, kasi based on the guidelines, no? Iinom kayo ng doxycycline. No? Okay. So I just want to clarify that. No? Kasi I'm just giving the lecture based on the guidelines given by the government, no? by the DOH. No? Pero case to case din yon. No? So pag may sugat, yon, I would agree na ano ka na, uminom ka na. Pero kung walang sugat, no, you don't have to take. Okay. Any more input? Leptospirosis. Mahirap i-differentiate things from dengue, from COVID, flu at this time. No? So kahit na nababad ka sa baha at meron kang flu-like symptoms, okay, it does not mean automatically you have leptospirosis. Baka dengue pa rin. No? Baka dengue or flu or COVID-19. No? Okay. So kung mataas ang incidence ng COVID-19 pa in the Philippines, then your first consideration will be, if you have flu-like symptoms, will be COVID. No? I suppose marami pang may COVID sa Philippines, sa Manila, di ba? Sa Pilipinas, di ba? So I don't have statistics on how between flu and COVID, anong mas common na ngayon. No? Baka COVID pa rin. No? Baka COVID pa rin. Yung dengue, mahirap din i-differentiate. No? Dengue, saka yung and other diseases. Kaya ang sabi ko, or my previous lecture, sabi ko, if you have flu-like symptoms, no, try to rest right away, build up your resistance, and then observe mo ng sarili mo. No? Observe mo until kung merong clue, lalabas yung clue naman. Kung talagang may clue that you are dealing with dengue, then paggamot ka na ng dengue. No? Or even with dengue, mild dengue, usually kusang nawawala rin yan. No? Okay. So, pinaka-importante, rest. Rest. No? Maraming fluid na iniinom. No? And then, healthy diet, little exercise. No? So, most of the time, you will recover even without getting to the exact diagnosis. Kung minsan hindi rin makita kung ano, kung hindi natin malalaman kung ano exact diagnosis, but you just rest kung saan mawawala, di okay na yon, no? Pabayaan na lang, naka-recover ka na. No? Okay. So, wag isang kibot ay magpapa-examine. No? Wag magpapanik muna. Basta mag-rest lang kayo, no? Right away. So, any other comments before we call it a day?
Nelly mo has a question.
Ano yung question?
OTC ba yung gamot na yan?
Ano?
Doc, OTC ba yung gamot na yan?
Yung doxycycline, hindi. Dapat may prescription. Okay? Antibiotics kasi siya eh. So, ampicillin, makakakuha ba kayo ng ano? Ampicillin is also antibiotics, although it's very common. No?
Pwede OTC?
Hindi siya OTC.
Pati amoxicillin?
Amoxicillin dapat, hindi. Pero yung iba nakakalusot. Diba? Ibang butika nagbibigay. Diba? Pero strictly speaking, all antibiotics are not OTC. No? Okay.
Thank you, Doc.
Baka pwede kayong bumili sa ano? Online. Pag online ba, do they require? I'm just wondering kasi may online, maraming online dyan, di ba? Do they require the prescription? Anybody?
Hindi pa nasubukan online.
Mukhang humingi ba sila ng prescription of the doctors pag online? Baka parang Lazada, you just order, baka dadali na sa'yo. Anybody? Wala? Walang experience with online?
Sa Mercury ho, they require.
They require.
If you're going to buy, like over the phone, you can Viber the prescription.
The picture of the prescription.
Yes, they will accept that if kung meron. Pero
Okay.
kung suki ka ho, minsan they will let go. Okay lang sa kanila.
Oo. Yeah.
Oo, if they know you already.
Yeah.
I just want to share, Doc, what my father told me. When you buy canned goods from the grocery or the supermarket or mga Tetra Paks, always wash.
The can. Yung sa itaas.
Oo, kasi nga, may daga rin ho, di ba? At night, they come out kahit na sa supermarket, na malamang. So you have to wash them before opening.
How many knows that? How many knows about that story?
Me.
You, sino pa?
Me too.
Lahat tayo matatanda na, kaya alam natin.
Oo, yung mga hindi.
Yung
Ano na yung mga Coke, yung mga nasa canned drinks.
Yan, canned goods, yeah.
No,
Cans, Coke in cans.
Yeah, mga Sprite in can, Coke in can.
Yes, always wash them.
Always wash it first.
lahat
Bago
na.
yun.
Lahat na, di ba? Lahat na.
Lahat na, oo.
Lahat na
Pati-
tinapay.
Wash. So yeah, I've heard of that also, yung canned goods na iwa-wash, no, before you open it. Okay. So, lahat,
Better
i-apply mo na sa lahat.
Better safe than sorry. Tsaka well, I guess it applies to all naman, pero as much as possible daw, do not get the canned goods or whatever from the bottom shelf.
From
Try
the
to get it.
bottom. From the bottom?
Don't get those in the bottom shelf. Yung higher up, kasi nga, chances are, dinagdalat sila.
Akala ko pag nasa higher up, doon siya tumatae.
Hindi ko alam. Yun lang ho ang sabi sa akin.
Kasi kung naka-pile siya, di ba? One over the other. So, I don't know. Basta.
Yung sa shelf, di ba may high shelf, middle.
Yung shelf mismo.
So, don't get anything from the bottom shelf.
Sa lower shelves. Okay. Pwede. No? Doon sila pumupunta kasi. No? Okay. Yeah. Okay. So, to apply to everything, just be, importante yung cleanliness and everything. Wash, no? Hand hygiene, wash everything before you eat, before you take it. No? Okay. Okay. Any more? At ano yung Crisessia? Okay, may ano itong, waterproof? Chris?
Hello, Doc. Hello, everyone. Good afternoon. Opo. Actually, dati, nung tag-ulan-ulan, naghanap na rin ako ng ganito kasi nga yung anak ko nalabas ng school. So, yun. Meron po ako nakita to sa online. Para lalagay mo lang siya sa ibabaw ng shoes mo. Tapos hindi ko lang po alam kasi hindi ko pa siya na-try. Pero gusto ko nang mag-buy na to bago magpasukan po kasi yun nga din po naisip ko. Share ko lang. Ano siya, Doc? Parang shoes mo, tapos ilalagay mo siya, tapos pwede ka na maglakad sa medyo mabaha na place. Like pag pupunta ka lalabas ka, punta ka ng school. Ganun po, Doc.
Water repellent siya? Waterproof?
Opo. Sabi dito waterproof po. Tapos meron siya, yung sole niya medyo makapal.
Yung sole?
Opo. Kaya balitaan ko kayo, Doc, kasi balak ko din mag-order talaga nito kasi magpapasukan na ngayong.
Tama. I'm also considering that.
Opo. Sa mga online, Doc, meron. Tapos meron din yan, meron din yan mas yung mid-cut lang. Tingin ko mas magandang klase yon kasi siya parang boots talaga itsura niya, tapos may zip lang siya . pero mid-cut lang siya, ipapasok mo lang yung shoes mo dun para mas makapal din po yun. Pero kasi sa case namin, sa nakikita ko sa anak ko, mas
Oo.
applicable to sa amin kasi lalaki siya, alam mo naman pag batang lalaki kaya po ito po yung naisip ko na orderin po para po sa anak ko.
Good. Very good. Thank you for sharing. Yan ang hinahanap natin. Kaya sabi ko kanina kung merong parang entrepreneurial na dapat gumawa silang ganito. Malaking kita nito, di ba? May market ito. Sige, magkano kaya yan? Nakalagay ba?
Ano Doc, mura lang to nasa mga 98 pesos, 100 pesos.
Talaga?
Opo, opo.
One
Pero
use?
siguro, di naman Doc, parang reusable naman po siya. Siguro ang mas maganda lang nito, mas pipiliin mo yung medyo mahal kasi mas alam mo yung quality, mas makapal siguro. Kasi meron siyang 99, meron din po siyang 120 pesos, ganyan po Doc.
Mhm. Oh, sige. So, kailan ka bibili?
O-order pa ako. Before po magpasukan yung anak ko po, this month po bibili ako. Balitaan ko kayo Doc.
Balitaan mo kami. Para
Sige
alam
po.
natin. Na? Oh,
Okay po.
very good. Thank you. Thank you for sharing. Yan nakagandahan itong pep talk. Maraming nag-share. Okay. Any more comments?
Doc, I have a question. This is
Okay.
Mary.
Mary, okay. Si Midler
You
class.
know, when people are told to take antibiotics, dapat one straight week pag may infection. How is the once a week na antibiotic effective then?
Okay, good question. When I was a student, ganun din yung tinuturo sa amin. No? When you take an antibiotic, usually 1 week, no? 1 week, number one, for the following reasons, para hindi mag-develop ng resistance yung mikrobyo dun sa antibiotics. No? Kasi kung kulang, kung less than 1 week, baka lumakas yung yung mikrobyo at hindi na kaya ng antibiotics. No? Okay. And the other one is para complete ang treatment, di ba? Kasi kung 1 day lang iinumin mo, baka hindi pa kasya, di ba? So that's the second reason, no? Okay. But over the years, I've been learning that it depends, no? Merong mga regimen na once a day, twice, or for 1 day lang. Yung iba naman 3 days, yung iba 7 days, yung iba pa pwedeng mas mahaba, mga 10 days pwede pa rin, di ba? Iba-iba. So
But that is daily. Doc, that is daily.
Pardon?
Daily you take, diba? Whether once a day or twice a day, it's daily for whether 1 week or 10 days, as you said. But this prophylaxis thing is once a week.
Yeah.
For 4 weeks. But
Okay.
that's not every day, diba?
I said I think they based on the recommendations, no, on studies na pwede, na pwede na effective siya at probably it will not cause resistance, na. Okay. So that's the bottom line is that may mga hindi na yung absolute na 1 week, no? Hindi na absolute 'yon, no? So pwedeng iba-iba ang regimen, no? Depending on the studies, no? So the studies have shown that once a week na iinom ka, na. Okay. And then I think it's also applicable, if correct me if I'm wrong, yung mga chronic UTI, na, yung may mga matatanda na chronic UTI, ganun. Hello. Chronic UTI, kumisan they just give it once a week also, ganun, no? So there are studies that show that na pwede, then they recommend it into the public, not to the doctors, no? So pwede, no? Okay.
So basically it's low dose siya.
Yung sa UTI.
So once a week.
Yung sa UTI, pero ito 200 pa rin eh. Pero once a week ito sa recommendation ng San Lazaro, no? Okay. That's why I want to see kung nasaan at kung pwede pa itong recommendations nito no? Kasi I'm looking for the international recommendations. Walang sinasabing ganon no? Okay. They just say kung na-expose ka, you just take it for 3 days, no? 3 to 5 days, no? Okay, take it as parang isang lang, short term na gamutan, no? Okay. So anyway, just to let you know that if, nowadays it's not we don't follow that 1 week rule. May mga exceptions that to that rule, no? Okay. Parang gonorrhea, pag yung mga gonorrhea, baka pwedeng 1 dose lang, pwede na, prophylaxis lang, na? And then the other will be 3 days, iba 5 days, iba-iba, na? Okay.
Okay.
Kaya as doctors, mahirap nga i-memorize yung mga guidelines na yan
Okay, thank you, Doc.
Okay. And any more? Good questions.
Ako yung mga plastic shoes cover.
Oh,
Sa marketplace mura pala kaysa sa SM.
silicone.
Oh, mas mura.
Meron 140.
Mura. Mga sa SM 350 Doc
Ha?
Nakita ko nung nakaraan 350 sa SM.
Sa baha.
Mura pala sa marketplace.
Which one? Dilabit na dito.
Mahal sa SM 350 yung malinggit.
Palengke po mas mura.
Pero sabi nila yung isip ko, nag-boots ka sa baha, madulas naman, di ba?
Yung sole, ma'am, hindi naman siya madulas. Rubberized po yung
Non-slippery po yan lahat.
Everybody, nakikita niyo yung picture sa chat? Nakikita niya?
Walang pala
Lahat?
Saan?
Okay, how do we share it?
Ma'am, hindi kaya.
Masishare mo ba, Marian?
Naka-everyone po yan
Sige.
Dapat po kayo.
Pero hindi yata sila marunong mag-chat.
Nakikita po, Doc. Nakita ko po.
Nakikita po.
Nakita niyo sa
Nakikita po.
chat.
Nakita po.
Opo.
Sa lang po yan sa marketplace kaya mura. Sa SM mahal 350 yung maliit.
Sa Shopee po, i-try nyo mas mura. Kaso lang, ayun, ibabalikan ko kayo kasi o-order ako Titignan ko po. Kasi yung napili ko, nasa 98 pesos lang yun
Oh, 98.
Teka,
Ayun pala, ang dami palang nagma-market nito.
Opo.
So, dapat bumili na rin kayo. Tayo. Bumili na rin tayo.
Yes.
Just to, kasi portable na ito, di ba? You can keep it sa bag ninyo. Okay. I will, sige, I'll wait for Chris. I'll wait for Marian. Marian, research nga.
Opo.
Tapos share mo nga sa Facebook, sa Pep Talk group natin. Okay. I'm also interested kasi the other week when I was about to go to church, biglang umulan, biglang flash flood, baha. So, first impulse is huhugas ako ng paa, kaya nagsimula ng mass. Kaya hindi ko nahugas yung paa ko. Pero when I went home, hinugasan ko agad. Okay. Okay. Kasi basta the mere fact na tatapak ako sa mga flood water, takot na ako Okay. Dati hindi, di ba? Dati pagka, flood lang yan, sige, tapak lang. After that, baliwala. Di ba? Okay.
Dati po, Doc, nung student pa kami, di ba sa TUP, pagdadaan pag umuulan, baha ka agad sa area natin, Manila.
Sa TAP.
Opo, lalakad ka. Parang wala lang sa amin dati. Napakadelikado pala.
Oo. Even during those, parang hindi naman masyadong madalas, pero delikado. Kasi in PGH, I've seen that during my internship, marami na ako nakikita talagang lepto na may kidney problem na. Yung malala na, may kidney, nagda-dialysis na. Yung iba namamatay rin Okay? So, thank you. I think this is very, kaya ako itong pinili, no? Kasi 2 weeks na umuulan eh, di ba? Butit na lang today may araw no? Butit na lang, no? So 2 weeks na umuulan, kaya inisip ko na ano, just insert this topic, leptospirosis, no? Okay. At maganda naman that we are more aware of the danger and how to protect ourselves. And now, the best part of this pep talk is we're now looking at something that can protect us. We will now wait for Chris and Mary Ann to recommend to us kung ano yung pinakamagandang protective shoes, protective waterproof shoes cover. No? Okay, we will wait for you, Mary Ann, Chris. No? Okay.
Okay po, Doc.
Okay. So thank you. We will see each other next week. I still don't have a particular topic in mind. Titingnan ko. No? Okay. So, but for sure we will have a session next week. No? Okay. As
Dok,
I
ayan
said-
po nakita ko 68 sa Shopee.
Ano?
68 lang sa Shopee.
Anong model? Which
Ayan
one?
po yung last.
Yung last? 68? Anong quality? Anong quality? Maganda? Maganda yung quality?
Kalagay lang waterproof long shoe cover with zipper.
Saan yun? Saan? Sa Shopee?
Shopee po to. Opo.
Kung 68 na, sige, subukan na lang natin.
Dapat siguro walang zipper
August
kasi papasok yung tubig sa zipper, dapat saradong-sarado siguro.
Okay.
Diba? Yung unang pictures, yung walang zipper, yung sushoot mo lang, susot mo hanggang ganito yung garter na sa taas. Kasi pag
Garter,
zipper, papasok din yung tubig sa loob, diba?
Meron siya, ma'am, yung zipper na yon, meron siya sa loob pa po na parang naka-protector pa. Meron pa po siya sa loob, ma'am. Opo. Parang pangsikip lang yata yung zipper po, ma'am.
Sinatry ko minsan yung zipper pumapasok sa
Nasa gilid po yung zipper, yung sa picture.
Oo.
Sige. Anyway, pag sinong nakabili,
kailangan yung size ng
share na
paa.
lang, ha? I-share na lang sa akin, ha? Kung sinong nakabili, i-share na lang. Okay? So, thank you. We'll see each other again next week. No? Thank you for attending this session. Okay. So, bye-bye.
Bye-bye. Have a nice weekend.
Bye.
Bye, everyone. Thank
Bye.
you.
Bye.
Ingat po tayo.
Ingat lang, ha? Ingat lang.